these are some exercises that you can do for some inner elbow pain. So if we've got pain on this side, that's where a lot of the muscles that do this and do this movement and also do this movement reside. So what we can do, two things. One is if it's really the tendon that's being the issue, we want to bring more blood flow to that tendon before doing activity, and that's going to hurt less during the activity. Might hurt a little bit during this exercise though, so we can either use our other hand or a wall or something else that isn't going to move to try to do this movement. So I'm trying to do this movement with this wrist, but I'm resisting it with this hand. So you can push as much as you like. I'd say maybe do 20, 30, 40, 50% effort, because you're going to be holding this for 45 seconds to a minute. So it's going to get harder the longer you hold it, and you're going to do it 5 times. So that might start to hurt a little bit, but not too much, like less than a 4 out of 10 pain. So yeah, you can either just do this movement if you want. If you feel like this movement actually makes it come on more, the pain, then just again use your hand or use something that you're trying to do this movement, and the other thing or your hand is resisting the movement. So again, holding that movement. So do the movement that kind of hurts in there, and you're going to hold it against resistance for 45 seconds to 60 seconds. You're going to do it 5 times every day, at least once. Best done before the activity that you would normally do that would annoy it. Another thing that you can do, if these muscles are really tight, to loosen it off, is you can do the opposite movement. So if this hurts, this generally the brain will send a signal to turn off those muscles. So again, you can either go against a wall doing that movement, or use your hand. Easiest, you can do it anywhere. So using my hand. Now this one I'm going to do a lot less effort, maybe like 10% up to 20% effort. So just gently trying to move in the opposite direction of the one that hurts. And that will turn these muscles on and send a signal to relax these ones. So again, if going back is not the one, if instead it's this motion, so just use your hand in a way that you can resist this motion. So the rules are, the joint doesn't move, you're only engaging the muscles by pressing against your hand or another surface that's not moving, whilst you engage those muscles 10-20% in the opposite direction of pain, and that's for 5 seconds, and you do it 3 times. So these are 2 different exercises. One is towards the pain for 45 seconds to a minute, and that's a bit more effort, and that's to get blood flow. That really helps with tendons. And the other exercise is to wind down the pain, stretch out those muscles, and that's gently pushing in the opposite direction for 5 seconds 3 times. All right, give those a go, see how it feels.